where I've been to, they're using teachers who are volunteers, all sorts of people from all backgrounds because they're being overrun. Now, I'm just concerned that don't we think that that will place the people who volunteers who are washing at risk?
In terms of your question about training and putting people at risk, as we said, we cannot forego a ghusl based on our
risk assessment.
Well, we can make our own risk assessment, but we've got to take precautions. If we take precautions, the ghusl can be done. Now, if we need more people to be volunteering, there's been lots of messages going out and lots of people are volunteering. So we don't have to have the same people doing the ghusl all the time. Some of the documents that are out there which tell you how it is possible to do the ghusl. WHO document from World Health Organization, you will get the European document from Infection Control Europe, you will get the Royal College of Pathologists, you will get the American document, which all mention that it is safe to touch the body as long as your skin is covered, And you should just, and we'll send you the videos of how to put on the PPE and how to take off the PPE. And the PPE is not the very heavy, the mask that sticks to your mouth. No, it's just a normal mask that you wear when you go to the hospital sometimes and you're asked to wear a mask. It's just that normal mask. And these are very easily available. Aprons are very easily available. So all these items are very easily available. Yes. And it's as long as we take precaution, and I emphasize that we must look at those videos which mention PPE and how to take off PPE and make sure there's no skin contact. Inshallah, there will be no issue.
Yes. Sorry, just a quick one. Can you just emphasize that even if there are volunteers, can we not have anybody over the age of 60, please? Can we just re-emphasize that? That is very important, because I think that is going to be the issue. And one final point, please. Can we please make sure that those people who have been in touch with COVID-19 when they were alive, they should not be attending cemeteries, please. Yes. Because they are more of a risk to anybody who's going to be there. I know you're your father being buried, your mother being buried, but you are more of a risk to the entire community. So that's the only thing I'll emphasize.
Very quick question. Maybe Muhammad can help. Regards to sourcing PPE, so we mentioned it's quite basic: the mask, the gloves, spectacles. Maybe there's other items we need to buy as well. Disinfectant spray. All of this. I've just been looking online, eBay, other websites. It's very hard to get hold of. What does the panel suggest in regards to sourcing the supplies?
I think in terms of sourcing PPE, remember, we're not looking for the high grade PPE. We're looking for PPE that is enough to do the washing. What we've done locally is we've got a few volunteers who are trying to source. And they are coming back and saying, okay, we found something here, found something here. And then we've got lots of charities who are ready to pay for it. So if you can find individuals who can take some time out and try and source the PPE, inshallah, you'll be able to find it and you'll get charities easily to pay for it. There's already charities who've put their name out there to say, if you need any money for this kind of equipment, let us know and we will pay.
Okay.
If we are going to use volunteers, then you are liable. If something goes wrong, you are liable to prosecution. If you are going to use any volunteers, you need to make them sign a disclaimer notice.
Yeah.
They have to make, otherwise we will have problems if something goes wrong.
Okay, that's fine. I think Dr. Shuja Sahab, I think that's very reasonable as well. But I'm pretty sure those who are volunteering, they will sign the disclaimer as well. But I think that's fine. That's very, very good idea.
One of the FDs, he's stating and implying the message to everybody that long as the body is left to the refrigeration for 48 hours, that's when he's going to handle it, because that's what he's been told, that it's not infectious after 48 hours. Can you give some clarification on that?
I will come back to you on this. I've read in some of the documents, like I think in the World Health Organization document, on COVID-19 and burials, it mentions that you should delay the funeral slightly, but it doesn't say that it's going to be hazardous if you do it quickly as well.
To say that, you know, the guidance that's been given is perfect, very good. What we need is both stress the importance of taking preventive measures. That's one. And the other is demonstration would be one of the things. Just a video would not be sufficient in my view. Maybe those who are doing the ghusl in practice for the Muslim community, maybe they should demonstrate under the current conditions how it is being done.
Yes.
And the other point I'd like to make is the guidance may be coming from all sorts of sources, which is also useful, and there may be some differences, and there may be some, most of them may be uniform. But I think each practitioner has to have then a SOP for their own selves written on the basis of the guidance. And that's got to be a detailed document, and that document should be, I know Maulana Yunus said that, you know, it's being done with the PHE or the government. I think their involvement is important, but I think we need to not just completely depend on them.
Yeah.
It's the practitioners who should be the authors or the initiators of that guidance, done in conjunction with the PHE or the government bodies, and then co-branded. So the SOP is the NBC or whatever's SOP,
yeah,
for the sake of practitioners, which is co-branded by PHE. The guidance that we are getting is the guidance from PHE or government bodies, which, if they allow, it would be good to be co-branded. So you're the sub thing in the main guidance, and they are the sub ones giving that confidence in the SOPs.
And just following on from my Yunus Sab's answer, so for example, Guy's St. Thomas Hospital Trust, they've had a policy for many years now that any bodies that are deceased from infection, they will be double sealed, and that makes it very difficult to do ghusl. So in the short amount of time that we have, you know, are we going to be able to sort of convince them otherwise to change the trust-wide policy? What do you advise on this?
So even though the bag is sealed, we can, when we get the body, we can go and do ghusl. There's nothing stopping us from breaking the seal and opening the bag and doing the ghusl. Mohammed Umar?
Sorry, just to tell you, all the deceased I've received, right, is only one where there was with a double bag. And the reason why it was with a double bag, because there was a lot of liquid coming out, blood
Leakage.
and all that.
Yeah.
Yeah, so leakage, so we didn't touch that, right? But all of the other ones were very simple. And when now, nobody have I received which is sealed. It is zipped. It's not sealed. None of the bodies I've received is been sealed. So if it is sealed, then they would put a seal on it that you are not able to open it. This is just a zipped body bag. That's all I've received. All the deceased I've received it only on that one. And even the double bag was not sealed. It was just zipped. So there is a difference between sealed and the difference between zipped. Please.
But as I said, I think in Excel they are thinking of sealing the bags. But again, that is just for safety reasons. It does not stop anyone from, after the funeral director has picked up the bag, we carry on as normal as we have been doing everywhere else. So there's no issue in us unsealing the bag or breaking the seal and washing as per our duty towards the deceased.
Okay. Maulana, they're trying to keep, the reason why they're also sealing it, because they are not knowing how long the body will be remaining in storage. That's the issue they also have.
Yes.
Because that's the problem. They said if it's going to remain there for 1 month, it's going to be sick. That might be a more risk of that aspect of it. And that was the main reason also. Not main reason, that's one of the reasons why they wanted to also put it in a seal bag.
My question is, as a masjid, what we are planning at the moment is to, if it's slow bodies coming in, then we're going to just start doing the ghusl in the masjid, Quba, and also in Clapton. And if there's an increase of excess deaths, then we're going to set up a little tent outside and do ghusls in there. And the plan is to then take the body in the masjid and to do the janazah. Based on what Muhammad Umar Bey said about disinfecting the whole place, including handles, etc., my question is, would it be better to just set a tent outside and just do ghusls there, just to eliminate spreading and that kind of stuff? So there's less to disinfect, is less chances to mess up.
Mohammed Umar, your thoughts on that?
Yeah. My thoughts on that would be that I would very much encourage that you have centers where you do COVID-19 ghusls and you have centers where you do non-COVID centers. So that's what you should do.
Okay.
Having a tent is a wonderful idea. But my only vision would be that if you have a tent in your back garden or if neighbors can see, it's not really nice. That would be my concern on it, right? I would rather you have a enclosed, even if you have a container which is converted into a ghusl or wash facilities, would be much better in my view, right? Because a tent will be fine, but then you also know that the tent as well, you don't know whether if there's been any particles. That's why are we washing door handles and all that as well, because we don't know what we are touching, right? So when you are entering the tent, you might be touching the tent, you don't know. But my view would be, is that why don't we select certain centers which will handle COVID-19 cases, wherever it may be, right? So they're dedicated, because remember, all of us must remember, we are going to get natural deaths as well.
Yeah.
Okay. Mullah Zakaria, I think if you look at the dignity and the whether it's concealed area, so it's going straight from the mosque into the tent.
Yeah.
So the tent is
that is the plan. We've got walls on both sides.
Yeah. So I think maybe it might be better, because yesterday when I asked the infection control about this, he said that would be easy to hose down as well.
Yeah, that's what I'm thinking.
So I think it might be a good idea, but I'll ask the infection control guy again tomorrow. If you've got somebody in your locality who works in infection control, if they can come and have a look, that will be better.
Made at Atkinson Molly, and they've used, now they're going to use all the floors only for COVID-19. It's a number of patients are increasing. There's few other Muslim patients there. At the moment, I've just been advised, obviously I can stand outside, but cannot go directly inside because of the PPE issue.
Yeah, I've been attending on behalf of Faiths Forum, a conference calls around London and logistics and transport activity. And in there, I picked up a thing about the funeral directors when they go, we're talking here about the community deaths. If they go to the house of the family, they ask first the family members to go into a separate room as a part of social distancing, and then carry out their activity. And I thought there should be a proper decorum, a discipline in which they, on how they perform it. Imagine the psychology or the worries about the bereaved, and then they've been treated as if they were a little bit different from the rest and removed from there without due explanation and consideration. I think what I've suggested, and we need to actually implement that, is there should be a proper protocol, SOP, which has on the same document what is expected of the family and what is expected of the funeral directors who go to pick up, so that one is not surprised by the other and we do not cause more than what they already are worried about. I think that's important throughout. Because just imagine when the funeral directors go and pick up the body in a hospital, all the provisions of safety and infection control and all that are already there in existence. That is not the case, obviously, within the family, within the family structure. About 10% of the COVID-related deaths currently are said to be at the home. And this is going to rise. In the next 2 or 3 weeks, it is expected to be 15 weeks, and it will go further up. So I think we've got to look very carefully about how we protect and also manage the community and the family, and not add to the distress that they already are under.
Maulana, Jazakallah for all this helpful information. Allah Ta'ala reward you and all those that have facilitated this program. You know, we need to give people hope and encouragement, Maulana, you know.
Inshallah. Jazakallah khair.